How's it going, guys? So this is Dr. Suh at Specific Chiropractic, providing Gonstead Chiropractic in Manhattan, New York City, NYC. So we got a special guest over here. Wholesale, what can I help you with, young lady?
Well, hi, I have scoliosis and I've been having some troubles lately. I've been with scoliosis, it might be having trouble with standing up. You might also be having trouble with walking, running, or any specific running or thing serious.
Okay, so when you run, what kind of troubles do you have doing that?
The troubles I have is just staying straight, basically. When I usually walk, run, or stand, I just tilt to one side, kind of like this.
Gotcha. Okay. All right, let's take a look. Go ahead, go walk down the hallway. All right, so we already can see some potential problems already because while you're walking, turn around, okay? What I'm seeing is this hip on the left side, that's not moving too well compared to the right. And also the way you're compensating, you're moving a lot more towards this way, on the upper torso over here. That's why this is much more prominent, it's going backwards over here, much more easier. But this one, when I try to swing back this way, it's not doing that way. And now it looks like you also have some behavioral things going on. That's why you're not really swinging your arms for pendulum effect. But we are seeing some structural imbalances over here. So let's take a closer look. See what's going on down here. Why this left hip is not moving too well. So this is instrumentation right here. So basically, if there is any damaged tissue along the way, it's going to or excessive stress to the joint, it's going to cause an inflammatory response. And how the body deals with that is increased vascular supply to the area, and one of the byproducts is heat. So that's what I'm looking for. Is there any swelling, abnormal increased heat, like this device right here, just picked up something at this level. And we're gonna keep on looking way down below, and we got something on the left-hand side. Right there, way down below. Yeah. So I saw something over here. And there you have it. We're at that level. Yeah, a little reading. Way at the very top. Very small, right there. So there's some puffiness going on already. Some swelling over here. Pain right there, huh? Got it. Tender right there?
Yeah.
Pain? Yep. Yeah. That's not moving. Yeah, that's stuck. That left hip is not moving. Okay. What about right here?
Yeah.
Slightly, right? Yeah. Slightly. What about this fellow right here? Not too bad?
It's not that bad, but still.
Yeah. How about this fellow right here?
Yeah.
It's a little bit, right?
Yep.
Yeah. Okay, well, keep an eye on that fourth lumbar there. Yeah, I can see it over here too. Tender right there, huh? Yeah. See, another thing what I'm looking for as well, and it's a little hard to see because you got some hair in the way, but see this little caret sign she got going on over here? All right? Little inverted triangle shape, it's red. This usually has an inflammation due to the upper cervical nerve pressure going on. So something's inflamed that's irritating the nerves, and that's what causes that little inflammatory mark over here. And it's swollen and it's tender right there, right at the occiput. Tender right there, huh? And that's not moving either. Okay. Yeah, the hips are moving just fine on that aspect. Now we'll go a little lower. So, okay, stop. Okay, so normal, what I'm looking for is when I contact the PSIS, right, I want to see it move like this way. There's a slight fixation on here, But when I go to the PIS, again, normal it should go underneath because her legs are, she's doing the hip flexion. But on this one, on the left side, it's really deviating upwards. That tells me there's an external rotation going on over here. So go ahead, raise just the right leg. And we're checking the sacrum. I want to see everything pivoting in there. It's stuck over here. So do again, 2 stuck, 3's moving, 4 stuck. Okay, left leg only. 1 moving fine, 2 is moving too much, 3 is moving fine, 4 is moving too much. Go ahead, march again. No, just the left one. See, 5 is moving fine. So that already identifies, so she has a potential 2, 4, and this left ilium over here. Now, okay, lean back for me, please. Lean back, all the way, good. Now raise just the left. See, it's still fixated. Okay, just relax. So what I did over here was this, because there was a potential 4th lumbar nerve innervation. The nerves from the 4th lumbar innervates into the pelvis. So when I push a little forward and she put a little body weight on it, it frees up the nerve somewhat. And I retested it and it shows that, and notice no, the left ilium is still fixated over here. So note that left ilium, that's a true problem. I'm gonna let you know your scoliosis is actually not that severe, right?
Okay.
Because I don't see too much, severity in the degrees. So that's a good sign. Now, other component, what I am looking for is, because that's the left side over here, see these hips? I want to see it symmetrical. I want to see the same width, right? Do you notice this is much more narrow? This is much more wider, right?
Yes.
So that tells me, it says, no, right now, what your left hip is doing, you're like this, okay? And let's face it, if you're rotated so much like this way, I don't think you'll walk this way, correct? But that's exactly what we're seeing on you, because your hip, your shoulders, everything else, you're still like this, okay? Now the head has no choice but rotate toward this way. So in essence, what we got going on is the whole entire body, okay, it's steadily rotating like this. So if it's rotating like this, where do you think that twist is going to come from? The body has no choice but to compensate, right? Now, if we didn't have the gyroscope in our cerebellum and also the eye riding reflex, meaning even though your whole entire body is rotated this way, see your head, you can't be walking this way, correct? So that means, well, head got to be this way. How can I keep my head this way? That's what I'm saying. There you have 2 gyroscopes in your brain that forces your head, even though the rest of your body is rotated like this way, this is no, I'm not going to be over here, right? So that's why everything in the middle of it get twisted up. That's what you got over here. So the real answer is, no, I'd rather not disturb this, because if I try to play around with the middle, okay, and try to untwist it, guess what happens? You're still twisted somewhere else. Would it make a lot more sense as, hey, wait a second, why don't we just like untwist from the bottom and untwist everything else up? Wouldn't that make more sense, right? What do you think, Mama and Papa, right?
Yeah.
Wouldn't that make more sense? So that's what the strategy is over here, because we have all this twist to the point that you're so twisted up, your body did a defense mechanism. This one over here, normal, I want to see a little more upright. But because you're so wounded up, your belly starts going this way. And over here, okay, it starts to go a little more backwards over here. And your neck, you're supposed to be a forward, an interior forward motion in your neck. That's not the case. It went backwards. So much so that this winding effect, okay, we keep on winding it up. Where do you think it's going to go? Okay, it has to go somewhere, right? So your head, that's why you feel so much pressure right on the back of your head over here, because your whole entire spine is wound up like this way. And it's trying to go all the way and exit through your head. That's what it doesn't feel so fun. So we're going to address this fellow over here. Make this more balanced out. And then you're going to let me know how it feels with everything else the rest of your spine, including your head over there. How do you like the sound of that? Right? Sounds good, right? Okay, let's rock. Well, there it is. Okay, walk around. All right, tell me, what's different?
over here, like in my back.
Uh-huh.
Over here,
Show us over where?
kind of over here,
Uh-huh.
is a little different than before.
Different how?
It's like I feel like it's getting a little more kind of straight.
Straighter. All right. What about tension or pressure? How does that feel over there?
Over there, I don't really feel anything that much.
And what was it before?
Before, it felt a little, I felt a little something.
Yeah. So you felt like you were twisted up before, and now it's like less?
Mm-hmm.
Okay, so how much less would you say from 0 to 100%? How much less would you say?
Like 56% less.
50, 60% less?
Mhm.
Hey, that's a good progress, right? You like that?
Yeah.
All right, yeah, so do I. Okay, let's take a look at everything else. Have a seat. How's that now?
It hurts a little. It hurts less.
How much less would you say?
Like 70% less.
70% less. So that's what we're talking about before, you know. And we mentioned that your spine, you were all twisted up like this. So all I did was, I just unwinded your spine. Now it's not all the way here, all right? And I'll explain to you in a moment why. But you see over here, as we start untwisting your spine, that's what you notice is, wow, 60% better, 50, 60% better in your mid-back, and already 70% better in your neck, right? Because we start unwinding your spine over here. And as it starts unwinding, you may start eventually noticing, so no, she doesn't need that nice little brace you got wearing anymore, right? That's what the story is. Okay, all right. Anything else?
Nothing else.
All right, well, I'll see you next time, young lady. Okay, have a great one.
You too.
Phyllis, how's everything coming along since your last adjustment?
Since my last adjustment, everything's been going a lot better actually. With what has been done to me, I've stopped feeling any like pain or pressure since then. I haven't been getting it much.
Great. How's your mid-back?
My mid-back, it's going along pretty well, although it may have a little bit of pain sometimes.
Okay. How are things playing in the gym and sports and all that other stuff?
In sports, everything's going fine. Like I'm a normal human.
Hey, that's great. All right. Well, thank you for the updates.
You're welcome.
Give us the latest updates. How are things coming along so far?
It's going pretty well. Actually, I've not been getting that many pains as before.
Good.
And I kind of am starting to feel like I don't have it. Sometimes I forget that I even have it.
Mm-hmm.
And usually when I like stretch or do anything, it's just a non-effective. I don't get that much tired that much.
Okay.
And this part, like my back, most likely it doesn't hurt.
Yeah, that's great. How are things for running?
For running, it's not difficult at all. I actually have been running a lot, and it's not been hurting.
Hey, how do you like it so far, huh?
I like it a lot because I'm actually getting better, I think.
Hey, that's great. You are. All right. Well, thank you for the updates.
You're welcome.